I'm Dr. Dorothy Ponton of KnowYourBodyBetter.com, and I'd like to talk about chiropractic myths for women. A few have come up for me lately that are kind of a big deal, and some I think are kind of silly and fun. The biggest deal for me is when people say that chiropractic care isn't appropriate for pregnant women. And I take this a little to heart because I specialized in pregnancy care during my internship, and in the last 13 years have seen great results for pregnant women who are suffering when they're worrying about, can I put a vitamin or a mineral or a pain pill in my body when I'm worried about what's going to happen during my pregnancy, or even the first several months afterwards. We're often breastfeeding and still really watching what we eat or what medicines we take. Chiropractic care is very safe and very effective for pregnant women. Now, there could be some modifications to the standard chiropractic care, both in how we position a patient. I have a great table that has a belly section that drops away, and a big fluffy cushion gets put underneath the woman's belly to support her, and she can lay flat comfortably face down. Sometimes we can adjust someone on their side. Very often with pregnant women, we use a much lighter force, or we use a handheld adjusting device called an activator that can deliver this really targeted, small, but very precise force. And in that way, we can make adjusting a pregnant woman or a woman who's just given birth really safe and really effective. The next myth about women in chiropractic care that really gets me is this concept that if you've had surgery or you've just had a breast reduction or a breast augmentation, that you can't go in and have chiropractic care. And I've got to tell you, getting adjusted after you've had bed rest and anesthesia and all these really rough things on your body, getting adjusted can feel great. We might make some modifications, have you lay on your side, have you sitting or standing and use the activator instrument. But fairly soon after you've had surgery, I'd say even before you could tolerate laying face down on a massage table, you're going to be able to receive a light adjustment. And it can really help the recovery process and ease those aches and pains. So please do investigate what options your chiropractor has if you feel like you need an adjustment pretty soon after surgery. The next myth's a little silly, but I want to put it out there, and that is the myth that all chiropractors are going to make you give up all your high-heeled shoes. I have to tell you, I love my high heels. I sometimes even work in high heels, and I believe that there are such thing as the right high-heeled shoe for the right foot. And so I'm not going to make you give up your heels, I promise. Might make you choose different ones. Bring some of your favorites in and see, is this really a good fit for your foot? And if you still insist on wearing shoes that aren't right for your feet, then yes, getting extra adjustments can help support the foot. Adjusting the low back can help balance out what's going on with your feet. But no, I'm not going to make you give up all of your high heels, I promise.